Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today in the show, we have Bruce Rosky. He's a patient advocate. His KevinMD article is titled A Couple's Journey with a Rare Neurodegenerative Disorder. Bruce, welcome to the show.
Well, thank you very much for inviting me.
We'll get into the article in a little bit, but first off, just briefly share your story and journey to where you're at.
So my journey is with my wife, Jennifer. We've been married for 33 years. I'm a retired civil servant. She's a retired marketing executive. We have 3 adult children. And our journey on APBD began between the years of 2008 and 2012, where we had a string of issues where Jennifer was beginning to forget things. She was forgetting her client contacts. She was confused and unable to organize her work. She was beginning to pick up our youngest daughter at the bus stop. I thought these were just a byproduct of her very busy schedule, but it's kind of like a frog in the water. I wasn't noticing the progression until one day a friend of mine, and I think it was 2011 or 2012, brought my attention. She said, Bruce, my friend had just lost her sister to brain cancer. And she said, Jennifer's having symptoms very similar to what my sister had. I really think you should have it checked out. So we went to a neurologist who took an MRI, and it yielded a tremendous amount of white matter in her front temporal lobe area. But she passed all of her tests at the neurologist's office quite well. So what he said he wanted to do is just continue to monitor it, because he couldn't come out with the proper diagnosis at that time. So after 4 years of monitoring it, not having any change either in her MRIs or in her behavior, except for the fact that it seemed to decline a little bit, a cousin of mine was visiting, who visited periodically, and said, Bruce, you need to push this a little more. Something's going on with Jennifer, and it's more than just general forgetfulness. So pressing the neurologist, he sent us to UCLA, where after a visit of 3 neurologists and a couple of tests, we ended up in the office with the exam room with Dr. Brent Fogel, who took a history of her symptoms, her neuropathy, her feet were very numb, and for her incontinence, which was something else that we were struggling with. And we attributed it to a previous situation that she had many years ago, as well as her forgetfulness, and more importantly, her family history, which is through the Ashkenazi Jewish population. And he said, we probably need to do a genetic test, because he said there's 1 or 2 things we need to rule out. And through the genetic test, it yielded the fact that she had this very rare disease called adult polyglucosan body disease, which is an autosomal recessive gene inherited by her parents. Neither of them had the disease, but they carried the recessive gene. And they came together in Jennifer, which was something she's had in her entire life.
All right. So this is the rare neurodegenerative disorder that we're talking about, APBD. So tell us a little bit more about that, because I'm a physician. I'm going to be honest, I don't know too much about that. What are some of the characteristic symptoms and presentation, treatments, prognosis? Just give us a brief overview of that.
So I'm not a doctor either, but what I know about APBD is the body has the ability to produce glycogen, which it's basically stored energy that it releases back to the body for the body to function correctly. What Jennifer lacked, or what she had, was a mutation in what's called a GBE1 gene. Now, that's kind of a very detailed comment, but the GBE1 gene is the one that regulates the proper synthesis of glucose into glycogen so it could be utilized. What Jennifer's body does is produces glycogen in a malformed manner that can't be processed, can't be absorbed into the body. And so then the question was, where does it go? Well, it gets hooked onto neurons and nerves, and it ends up ultimately messing up the communication between different parts of the body and the brain. Ultimately, challenging the autonomic functions of the body, starting out with, well, in Jennifer's case, we were observing the cognitive decline as one aspect of the illness, but it doesn't happen in everybody. Jennifer also had a neurogenic bladder, where she was having challenges needing to void, not voiding when she needed to, et cetera, et cetera. And she also had numb feet, where she felt, she described it as walking on pebbles. So those were our first signs. Of course, the cognitive decline was what was our leading indicator why we went to the neurologist. The others just seemed like general aging issues. In fact, I believe APD is probably a very misdiagnosed disease, where it's diagnosed as something else most often. And that was Jennifer's path. Other people have paths where they have like an ocular atrophy, or they have swallowing issues, or there's other aspects that they come into contact with. And so everybody seems to to have a symptom of something that people then try to figure out what's going on. We were quite fortunate in our particular case. We didn't have a misdiagnosis. We just had no diagnosis, and we were in search of a diagnosis for the 4 to 5 years that we were meeting with different neurologists.
So you went to UCLA, who made this diagnosis. How did you and Jennifer cope emotionally with that? What was your reaction when you first heard this diagnosis?
Well, you know, if you were to ask me what was said in the room at that point in time, I probably won't remember the whole conversation. In fact, I don't even think, I'm sure he did explain what the disease meant and what it entailed. We just heard APBD, we heard no cure, and then I heard address symptoms as they come up. It felt somewhat settling to have something that I could latch onto and say, okay, this is something. That's my brain working. And then we would just address, you know, symptoms as they would come up. Jennifer's first question was, will I die from this? Mm-hmm. And Brett very honestly said, no, APDB won't kill you. However, it will impact all of your systems and something will happen that probably will kill you. To this day, I don't think she's really processed and understood what APBD is. But for the first number of years after we were diagnosed, we were just addressing very easily the symptoms as they would come up. So it was more of a, this is a problem, how do we solve it? This is a problem, how do we solve it? We have more neurological issues, is there a solution for that? We were having, and so that's how we were kind of approaching it, as well as just support for her ability to move around, her mobility issues. They were progressing as well. When we started, she was able to walk on her own, then we kind of did a cane, then we needed a walker. And so we were using a walker for a number of years, and now she's pretty much in a wheelchair. And she has some comorbidities as well, which that doesn't help in terms of sleeping issues, and she has narcolepsy and sleep apnea, and those aren't helping. So it's easy for us to address the cognitive issues, and the emotional issues are a whole different aspect. And it really wasn't until this past year that I've been faced with dealing with the emotional issues of caregiving, both for her and for myself. She is a very accepting individual. She's wonderful in terms of dealing with her situation. And every day she apologizes, and every day she tells me how much she appreciates me. And every day, no matter who walks into the room, whether it's a caregiver I have or at the doctor's office or a nurse who's changing her suprapubic catheter, she says, "Thank you very much. I appreciate you so much." And so from a caregiver to patient standpoint, Jennifer's a cakewalk. Because she's very, very, very good patient, but her illness is progressing, and it's hard from my standpoint as a caregiver to kind of resolve a lot of the emotional issues that come about, both as her husband and as her caregiver. I'm in 3 caregiver groups, and we're in a number of programs. One's through the Pacific Neuroscience Institute, and it's headed by Dr. Karen Miller. It helps us, gives a curriculum, so she has an activity to work on her cognitive skills, as well as they have a Fit Brain gym there that we do cognitive and movement at the same time. And then we have a support group that we meet. And so I have that one support group. I have one through the APBD group, and then I have a second one through the Pacific Neuroscience Institute that I meet with. And those tend to be my lifelines in terms of getting information and sharing thoughts and concerns, fears, and just understanding what's going on in my own brain. They have something called the 7 emotions of caregiving, and I find myself kind of vacillating between all of them in terms of anger, fear, worry, resentment, etc.
When you were first thrust into this caregiving role, was there any guidance initially? How did you learn to do what you needed to do as a caregiver?
Kevin, that's an excellent question. And quite frankly, dealing with the medical issues was a much easier solution. It wasn't until this year we had a number of hospital stays, and as her illness was progressing, and I saw there were so many different aspects of it. Not only does she have neurological issues and her mobility issues, but now she has her body temperature can't get regulated, and her blood pressure seems to be all over the board. Now she's having gastrointestinal issues. And I asked the neurologist at UCLA, I said, well, I need to, we came in, we got her diagnosis, we were referred to a genetic counselor, and I asked, can I speak with your social worker, because I really need some guidance on how to proceed with this. And he said, we don't have one in our department. And so that forced me to look through my own resources, which is when I began to get more involved with the Adult Polyglucosan Body Foundation in terms of resources they had. as well as the cohort of people who we get together with and to find out what's going on with other patients. I can kind of track Jennifer along the lines of some of the other patients that the caregivers are taking care of. But it basically is kind of on the job training. And I've done some reading in different books to try and get a sense of where I'm at in a caregiver perspective. But there's no roadmap and there's no direction in terms of how to address this particular issue, which is probably the most frustrating aspect. I don't know what to look for next. And so everything panics. I get into a little bit of a panic situation. I don't know whether or not it's attributed to her APBD or if it's just because she's tired or things such as that. So there was no clear direction on how to manage the situation other than do your best to address symptoms.
Of all the things that you mentioned, what would you say are some of the biggest challenges that you had to overcome as a caregiver?
Biggest challenges, probably maintaining balance and finding and keeping myself grounded. You know, when an emergency comes up, it's the adrenaline kicks in, and it's easier to address the issue. But you know, we spent many hours in emergency rooms and educating the emergency room doctors and educating the emergency room staff to what she's going through, and then they have to sadly Google it to find out what it's all about. And so it's a challenge that there's not a lot of information that's being taught. I know you can't learn all the diseases that there are out there, but it is a very frustrating aspect. So the challenge is really getting her the attention that she needs and keeping her supported the best we can.
I like to ask this question to patients, their advocates, and their families, because sometimes from the physician point of view, we often don't know what it's like on your side, seeing things through your perspective. So through your interactions with the healthcare system during this journey, what are some things that they did well, and what are some things that they could improve on?
Well, I certainly get good. Jennifer we get very good care. I always consider it a weak disease. We get very good care whenever we walked into the emergency rooms. What I wanted to do after one medical emergency room visit, Jennifer gets hypothermic, where her body temperature gets down into the 90, 91, 92 range. And when it goes below 90, we had a couple incidences where she had some cognitive edema and she had some seizures and she was basically in a coma for a day or two. And as she came out of it, I asked, how do I prevent, hypothermia? And although we get really good care in the hospital, what I didn't get is advice on how to prevent this, or at least how to pay attention to it. And so I literally take her temperature 3 or 4 times a day and constantly have the heat on in her room to make sure that it's always at a very high level, which means going out into the community or going outside, unless it's warm outside, is a challenge because she'll get cold very quickly. And the treatment we've been getting is really good. The prevention for some of these issues hasn't been as nice as I'd like it to see, nor providing the social work support when we kind of needed it to figure out how to chart our path.
Tell us a typical day, and there may be no day that is typical. What's a typical day like for you and Jennifer these days?
You're right, there's no typical day. We're having lots of challenges these days with Jennifer sleeping. And so we're lucky to get 2 to 3 hours of sleep every evening. She does have sleep apnea, so she gets the most beneficial sleep when she wears her CPAP machine, which is the constant pressure. But because she has cognitive decline, every day when we put it on, she's unclear of why we're doing this and she hates it and she hasn't really adopted it. So oftentimes I have an evening caregiver. About 6 months ago, I realized that if I'm going to get any sleep whatsoever, I need somebody to pay attention to her at nighttime. There were many times I would wake up and she'd be on the floor because she tried to get up, but she wasn't either awake or she was too weak, or could have been any one of a number of circumstances. And so to prevent that, I just have somebody there all night long. She hands it over to me in the morning, and I have to dress Jennifer. She has a suprapubic catheter, so we have to manage and maintain the catheter bag. So we have to change that every morning. I have somebody assist me a few mornings a week with Jennifer in terms of laundry and taking care of her room and getting her bathed. The days that they're not there, I usually give her a shower. Jennifer is moving very slowly these days, so there's not a lot she can do. We have physical therapy oftentimes 3 times a week, and occupational therapy. We have a program at the Pacific Neuroscience Institute that we go to. Jennifer blossoms when there's other people around. She really enjoys social interaction. I consider a trip to the doctor's office social interaction because it's time consuming. We try to bring people by, but I have noticed illnesses of Jennifer's kind are not something that people know how to address or deal with. And so many people, through the best of their intentions and offers, have not come by to be able to be with her. We've had a few people who have impressed me significantly with their ability to come by and visit. So through the course of the day, we get her ready. We'll either plan for the appointments that we have. She loves to crochet. She does that. And so I put things around her that she can do. I try to make sure she's awake and sufficiently at her desk when I have to leave to either run a quick errand or go to the grocery store. But I'm pretty much tethered to the house unless I have somebody else around to kind of watch her a little bit. In fact, we did have a situation recently, which I won't get into because it's complicated, but it made me think of what would be the situation if I just couldn't be there every day, if I had to be taken out of the house for whatever the reason is. So I'm working on solutions to that as well, and getting people lined up who can walk in the door if I have to walk out of the door. Jennifer does really well in terms of making sure she gets food in her system. She's a terrible drinker, but I think that's common among people with cognitive decline. They just forget to drink. We do a few exercises that we can, but she won't do them unless I'm there. We do have a pedaling machine that she can do at her desk. And in the evenings, we'll just spend time together, either watching something on Netflix, one of the streaming channels, or we'll play music and she'll do her crocheting and I'll do my reading and we'll just spend time together. And then I'll try to get her to bed somewhere between 10:30 and 11 in the event that those are the days that I don't have an evening caregiver. Most of the time we do have an evening caregiver and they're truly helpful and been very good for Jennifer because it's another face that she gets to see.
Now, let me ask, how are you doing? As you know, there's a phenomenon called, caregiver fatigue. Now, tell me some of the things that you're doing to either address or prevent that.
I am trying to maintain a routine exercise regime that's been beneficial to me. I just recently went back to my nutritionist, who I went to a number of years ago, and I said, if you cut my veins, all that would come out is cortisol. So we're working together on trying to get my systems working to get the cortisol out of my system as efficiently as possible. I find that caregiver groups are very grounding and very helpful. And anybody who's going through this as a caregiver, you can't do it alone. And I think that's one of the realizations I made on this journey is thinking I was strong enough to do it alone and not needing the help of anybody was woefully inaccurate. I also find just getting out once a week, just with my former colleagues and friends is very helpful. It makes me feel more normal. We often talk in our caregiver groups about our new normals. And I think that's kind of a misnomer because I don't think any new normal is a new normal. It might be your way of how you live your life, but I can't consider it my new normal. And I do I like myself being out with social interactions where I can feel more engaged and have a different focus. Because when I'm at home, my entire focus is just making sure Jennifer is taken care of and she's got what she needs.
We're talking to Bruce Rosky. He's a patient advocate. His KevinMD article is titled A Couple's Journey with a Rare Neurodegenerative Disorder. Bruce, for those other families who may be undergoing similar situations to what you and Jennifer are going through, what kind of advice do you have for them?
From a cognitive caregiving perspective, learn as much as you can in advance. What I've asked for, but nobody's been able to provide, not because they couldn't provide it, because they just don't know, is what to expect next. From an emotional side, I think take nothing for granted. That was shared with me many years ago by a college friend who lost their spouse unexpectedly. And I really never took it to heart until this past year with our near tragic experiences in emergency rooms and going through comas. And that I try to make sure every day counts and try to be mindful of where we're at and what we can do and appreciate that, however minor or trivial it is. Jennifer doing her exercise gets a high five. Being able to have a decent conversation is always very rewarding. And even I'll just sit around and I'll just hold her hand and it relaxes her, it relaxes me, and it helps with our anxiety in general. So I think those would be recommendations. Connect, be mindful, and be diligent.
And my final question, Bruce, tell us some of your take-home messages that you want to leave with the KevinMD audience.
I think that the technicians, the medical technicians, the clinicians, I guess we call them, have been really very helpful in terms of the medical side of what's going on. But it's so important to address the softer side of these kinds of illnesses in terms of what to do and how to manage and what to expect, quite frankly. I know that there's a hesitation to predict the future and how it'll be, but knowing what the future could be kind of informs what we do now. And although it might have been a harsh conversation to have and a difficult conversation, it would have been really helpful for us to know some better examples of Jennifer's disease, the APBD, and how patients live through it, and how to manage it, both cognitive and emotionally. And the more that can be done to that goal would be fantastic. And then, of course, continued research to find a solution, and or if possible, even a cure.
Bruce, thank you so much for sharing your story, time, and insight. Best wishes to both of you. Thanks again for being on the show.
Thank you, Kevin. It's been a pleasure.